Hello everyone, so let's review the acid-base imbalances, and I will also discuss the arterial blood gas analysis and how to do it. So again, acid-base imbalances, they're very important to be monitored, especially if you'll be dealing with patients who are critically unstable and has a metabolic or pulmonary disease processes going on. So remember that, again, to achieve homeostasis, we need to make sure that there is a balance between the acids and the bases. And as you can see here, there are different health problems that can lead to imbalance like diabetes, COPD, and kidney disease. Now, you will see here the normal values for ABG, and as you can see here, we'll be monitoring the pH, the PaCO2, the PaO2. Now, I want you to pay attention to the PaO2 because the normal value here is 80 to 100 millimeter mercury. However, if your patient has chronic respiratory disease like COPD, then you would notice that their partial pressure of oxygen is only at 60 millimeter mercury or above that, and that is a normal not normal but expected finding to this type of patients, because as you all know, with COPD, they normally have lung that is inflated, and they normally have a lot of CO2 in their lungs. So you would notice that their PaO2 is lower than it's supposed to be, and that is an expected finding. We don't need to panic if you see it is 60 or 65 millimeter mercury, because their body is used to it. Okay. Now with bicarb, as you can see here, it's 22 to 26. That's the normal value. We also monitor base excess, but this will just give you a hint if your patient is more on the alkaline side. Okay. We also monitor an ion gap. If you remember, if your patient is diabetic and they develop, let's say, DKA, is we monitor this anion gap. And again, the normal, when you check the blood, it should be between 3 to 10. But if you check the urine, the anion gap should be less than 20. The higher the number, that means that your patient is leading more towards metabolic acidosis. And again, this is used mostly to patients who have DKA. Now, I want to show you this chart. So, you can create this as like tic-tac-toe, or, the way you analyze the ABG results. Now, before I move to that, remember that PaCO2 is, you look at that. If it's abnormal, then it means your patient has a respiratory disease processes going on, and the lungs are starting to fail. While with bicarb, if you see that it is abnormal, then that means that the kidneys is failing also. But remember, these two parameters can also be normal, or it can be abnormal in a way that it is compensating with what's going on with your patient. Okay, now let's go back. So here are the normal values that I showed you earlier, right? Now, if your patient's lab value for pH is below 735 or 7.35, that's more on acidosis side. While if it's more than 7.46, that's more on alkalosis side. Okay, with PaCO2, if it's higher than 45, and you saw it, it's more acidotic. But if it's lower than 35, then that's more alkalosis. And for bicarb, lower than 22 is more acidosis, and higher than 26 is alkalosis. So that's why, when you're interpreting ABG, you can put on your paper 735, 745. 45, 35, 22, 26 to be able to memorize it, okay, in terms of to help you in ABG analysis. And I have some exercises for you that we can do. And normally for NCLEX purposes is you at least have a minute or less to be able to interpret them, okay? Now, this is just to show you how respiratory system is regulated. As you all know, the medulla oblongata is the respiratory center in our body. Okay, that's what, part of the brain telling us to breathe. Okay, it's not technically on the brain, it's below the it's the medulla oblongata and then the brainstem, if you remember, and it controls breathing. Now, with here, as you can see, is respirations increase lead to increased CO2 elimination. So when you see a patient hyperventilating, that means that that patient is blowing off too much CO2 in the external environment. But if your patient has shallow breathing, then that means the CO2 stays in the lungs. Okay? And of course, we check the CO2 level in the blood via ABG. So, we can use the radial artery, brachial artery, okay? As long as it's in the arteries, okay? Now, with renal system regulation, again, as I said earlier in the previous slide, that we look at the bicarb level. So, because the kidneys conserves bicarb and it excretes some acids, okay? And that's what the normal function of the renal system. And again, there are three mechanisms for removing acids, like for example, secreting free hydrogen, combining it with ammonia, or excreting, weak acids. And that's with the help of the kidneys. Now, let's move on to ABG interpretation. And, a lot of nurses and even nursing students are kind of intimidated with ABG interpretation. So I hope this presentation will help you to, have the self-confidence on that you can do this, okay? So the first thing you have to do when you see an ABG results is look at the pH, okay? If the pH is normal and it's within 7.35 to 7.45, then that means your patient is fully compensating, and that's a good thing, okay? Now, if you saw that the pH, let's say, is not within normal range, then your finding might be either partially compensated or uncompensated. Okay, but we will know what will be the answer on this when we look at the PaCO2 and the bicarb. Okay, now in looking at PaCO2 and bicarb, remember the acronym ROAM. This means that respiratory opposite. It means that if the pH is low, PaCO2 will be high. Okay, while Me is metabolic equal, it means that they have the same direction. If bicarb is low, pH will be low. If pH is high, bicarb will be high. Okay, so remember those things that I told you about Rome. Okay, now compensation. A lot of students like asking me, and even nurses, okay, what compensation mean? It means that the body is trying to do its best to maintain that homeostasis. So as I said, if the patient has good lung function, then of course the PaCO2 will tend to compensate, okay, based on the numeric value that you'll see. And this will bring the pH to a normal level. So that's why I said earlier, you have to look at the pH level. Okay. Now with bicarb is the same thing. It might be in an abnormal side, but it will bring the pH to normal level. That is fully compensation. Okay. Now Here, I also put with a bicarb, it slowed the rate of declining kidney function. It is reabsorbed and excreted via kidneys, byproduct of metabolism. Now, let's try this question number 1. And again, you might see some questions that have ABG results with it. So now I just want to focus on ABG interpretation, okay? Not with case scenario. So let's say you have this question and I'll give you a minute to answer this. Okay, when you're ready, I'm going to move on to the answer. So here, as you can see, our pH is within normal range, right? So I put here normal. Now, PaCO2, as you can see, it's kind of low, and the bicarb is a little bit in the low side. Now, when you use the tic-tac-toe, if you remember earlier the previous slide, let's start with pH. So pH is normal. However, when you plug in, is that the median of the pH is 7.4. Okay, that's your borderline. So anything beyond 7.45 we talked about earlier is alkalosis. But what if it's a normal? So if it's normal, you have to use the median number, which is 7.4. Remember that number. Now 7.4 and beyond, that would be alkalosis side, going towards alkalosis side. So that's why I put here 7.45 alkalosis. It is normal, but is very close to become alkalosis. Okay? PaCO2 is 30. It is low. But remember, when we plug in earlier, that 45 and beyond is more on acidosis side, and 35 below would be alkalosis side. So that's why I put 30 in the alkalosis. Now, if you forget, okay, go back to the previous slide that I was talking about earlier about this tic-tac-toe and about this table, okay? Now, let's move on to bicarb. Bicarb is 18 and it's low. Remember that the normal is 22 to 26, so anything below 22 is more acidotic, okay? Now, when you see this, this means, just looking at it, okay, pH is normal, so we can say this is fully compensated, okay? And when you look at PaCO2, again, PaCO2 represents respiratory, so it is fully compensated respiratory alkalosis. And that's the answer for this question. So as you can see in here, this is the answer, fully compensated respiratory alkalosis. And if you notice that the answer can be a respiratory metabolic depending on where the pH is. So wherever the pH is or close is, then that would be the answer. Okay? I hope you notice that. Now, this is the next question, and I want you to put it in your paper. And you can pause this video and try to answer it. And when you're ready, you can play this video again and resume. So this is the answer. So as you can see, the pH is 7.38. That is normal. However, remember earlier I told you, remember the median of pH when the pH is normal, and the median is 7.4. So 7.4 and below, that's closer to the acidosis side. So that's why I put 7.38 in the acidosis side. While PaCO2 is 30 again, so you know 30 is low and that would be alkalosis. While bicarb is 15, it's below 22, that is acidosis. So what do you think would be the answer? Remember, the answer follows the pH. And as you can see, what follows the pH is the bicarb, and that is metabolic. So that's why for this one is fully compensated metabolic acidosis. Okay, so this is the answer. Fully compensated metabolic acidosis. Now let's look at this question, number 3. Put it in your paper and try to interpret it in your own. When you're ready, resume this video. Now this is the answer. So as you can see for the pH, it's 7.2, so we know that's lower than 7.35, so we know that's acidosis. And PaCO2 is 50, so that means it is higher than 45. And as you all know, 45 and higher is on acidosis side. So that's why I put it here. And bicarb is 35, so that is higher than 26, so that is alkalosis. Okay. Now we know that the pH is not normal. So we know the answer in here, it's either partially compensated or uncompensated. Now, how do we know if it's partially compensated? We will know if it's partially compensated if the other value is on the opposite side. Okay, and as you can see here, the other value that is on the opposite side is bicarb. Okay, so we know that the answer here is partially compensated respiratory acidosis. Okay, now even though this is my last slide, you might be wondering, how do I know if it's uncompensated? The only time you would say if it's uncompensated, if this bicarb in here is also on the other side, which is in the acidosis side, then here your answer will change. Okay, so that's when you will say this is uncompensated. So I hope this will help you to be confident in doing your ABG analysis. Thank you.